Community service and not the police should be the first responder to mental health crisis. The tragic death of Afolabi in Winnipeg and the Somalian guy that was killed in Toronto shows why. Both cases reveal how law enforcement reliance on force escalates situations that requires care and not confrontation. Afolabi, a 19-year-old Nigerian international student at the University of Manitoba, was experiencing mental health crisis when police were called for a wellness check. Within seconds of arriving, officers shot him, claiming he was with a knife. His family insists that he was in a mental breakdown and needed support and not harmful force. All over the world, nobody likes the police because at the end of the day, only what police does is to harass and intimidate people. And what did they end up doing? They don't even care about the mental health of anybody. They only care about the force. They only care about saving themselves first. That's why all over the world, that whenever they call them for mental health crisis, it end up being the person dead. They end up shooting the person dead because they are not trained properly. They only train to escalate issue at the end of the day. There's a lot of things happening in Winnipeg at the end of the day that someone will be facing mental health issue and the police will come there and what they're going to end up doing is killing the person. And you find out that police being the first responder doesn't work anymore. That's why community-based service is the best, because they understand the mental health of the person. They understand what the person is going through. They understand that the person is going through a rough phase and they are there to help the person. Whereas the police, if the person show a little bit of sign, if the person shows a little bit sign of violence, they end up shooting the person because that is what their mind is wired to do. But anything that have to do with community-based, they make sure that the person receive adequate care. They make sure that they take the person seriously, because most of them working for community-based, they have experienced similar situation before in their lives. So that gives them the experience to know what to do. So I suggest that community-based service should be the first responder because they already passed through all those phases. Most of the people are well trained in that kind of situations and not the other way around. Why police are the wrong first responders? Escalation threats. Police are trained to control threats, not provide therapeutic intervention. When someone is in crisis, this approach leads to violence, distrust. Marginalized communities, immigrants, racialized groups often fear police involvement, making them less likely to seek help. Evidence of police being the first responder. Both Afolabi and the smaller guy that was killed in Toronto shows how quickly wellness check or public disturbance can turn fatal when the police are the first responders. Why community-based responders work better? De-escalation first. Mental health professionals and community service workers are trained to calm, listen, and stabilize rather than confront. Holistic support. They can connect individuals to housing, counseling, or medical care, addressing root causes instead of criminalizing distress. Some certain cities are already using this program already. Cities like Oregon, Eugene are already using this program, and it has been working for them so far. And the program is called cohort programs. And Toronto Pilot Community Crisis Service shows that non-police crisis team resolve most calls without violence. And I'm about to talk about the risk and trade-off, because anything that have to do with mental health crisis is taken seriously. Implementation challenges, required funding, training, and coordination with emergency services. Police resistance. Police will obviously resist to it because it will be like they are taking their work from them. Law enforcement units often resist reforms, fearing loss of authority, because police love authority, so they will always fight against it. Public perception. Some worry about safety of a person in armed. Like I know that whatever that we do in criminal justice, the public have to accept it at the end of the day. But evidence shows that community responders can call police only when absolutely necessary. So when the police are not needed, they don't need to call them. Like in these cases of someone being armed, that is the only time that the police should be there. Imagine that someone is having a mental health crisis and it's not armed. That is when the community service jumps in without the police. But when the person is armed to protect themselves, the mental health responders, like the community service responders, can have their own unit that de-escalate issues rather than even involving the police at the end of the day. The reason of this presentation is for this program to be introduced in Winnipeg, to be able to avoid this kind of tragedies that surrounds mental health crisis. Thank you very much. Until next time.